Hello and welcome back. This is Dr. Dan Hyatt. So it was great going over your x-rays with you within the last visit or two, and again it was great being able to show you the areas of your spine that needed our help. Today I want to review with you how we're going to help to restore that curve in your neck that's been lost. So we talked about how that curve in our neck, now this is the body is facing this way, this curve in our neck, they call this the arc of life. And they call it that because the nerves that come out of here, they go to our vital organs. They go to our heart, they go to our lungs. Those nerves go on up into the head, and they're the big power supply that go out to the arms. So this arc of life, it's very important that we help to restore that curve as close to normal as possible. Now there's a threefold approach that we use in our office, and we base it off of this little mnemonic EAT, E-A-T. E stands for exercises, A stands for adjustments, and T stands for traction. And I want to go through each of those. Now we're going to do a specific type of adjustment with you that's called a mirror image adjustment. And what that's going to do is it's going to help to take this curve, you'll be facing down, and it's going to help to push slowly and gently some curve, some arc back into your neck. Also, the exercises we're going to give you some things that are going to help to show you how to bring your head back over your center of gravity better, how your chin should come up a little bit higher, how your shoulders should be back a little bit further. We're going to show you all of those things. And today I want to show you a quick little video. This video is about how to do the T, the traction part. Again, the traction part we're going to be doing off of using a piece of equipment called a Denneroll. Not a dinner roll, but a Denneroll. And I'm going to go through this with you also. Before that, I want to just go through this quick protocol: mirror image exercises, mirror image adjustments, and mirror image traction. So again, under exercises, it says I'll give you these specific for your neck and explain how to do these at home. Adjustments, of course, we're going to be doing this at the office. They're called global adjustments and segmental adjustments. Global will help us with the whole neck, and the segmental will help us with the individual vertebrae that need to be adjusted. Now traction, this says done at home, and I'm going to explain now the use of the Denneroll home traction unit. The cost of this unit is $60. Now traction can be a scary term. Most people think about like hanging on a door, or they picture their head hanging off the end of the bed with weights attached. Now the Denneroll is the device that uses your own head's weight to gently traction your neck through the perfect angle called the absolute rotation angle. That's 43 degrees. If you remember, we went through that briefly when we looked at your x-rays. Now traction units used to cost over $1,000, then they were hundreds of dollars. Again, our Denneroll is $60, and this is what's going to give us the best chance at structural correction of your cervical spine from our office. And I tell patients this is going to act as the braces and the retainer for your neck. Now, to use the Denneroll, you're going to begin the first time doing it only for 3 minutes, and you do it once per day. The second day, you're going to do it for 4 minutes. The next day, 5 minutes, and so on, until we get to the goal range of 15 to 20 minutes. And I'll explain this more fully to you on your next visit. Now, with you doing exercises and Denneroll therapy, again, that's the traction at home, and me adjusting you at the office, we will be firing on all three of these EAT protocols. Our Denneroll comes in a box, and it looks like this. You'll pull this out of the box, and it's going to show you on the front, this says, I don't know if you can read it on the video or not, but it says shoulders this side. So we're going to teach you on your next visit how you're going to, I'll set this aside, we're going to teach you how you're going to lay on your back, and you're going to place the Denneroll under your neck, and it's going to just gently have the head hang off the back of the Denneroll. Now we're going to show you where do you put this Denneroll. Is it going to be in the lower neck? Is it going to be upper? We're going to show you the right size, so we'll fit that for you as well. Again, this is a very specific procedure, and it only takes a couple minutes to show you how to use this Denneroll. And given some time and consistency, we're going to see that arc of life, that loss of curve in your neck, we're going to see that curve being restored closer and closer towards normal. This is important not just for your present of feeling good, that's why you're here, to get relief as quick as possible, and that's going to help with this, but your future is important as well. When I look at an x-ray, again, I look at, this says 2017 on it right now, I look at 2022, 2027. Again, what's going to happen in 5 years from now or 10 years from now if we don't get your neck corrected? The worst case scenario, which happens in a lot of cases, is we lose more and more curve. That leads to more arthritis, it leads to more degeneration. It leads to bad discs that can eventually lead to surgery and other complications, and of course we don't want that to happen. So you're in the right spot. We're going to talk to you again on your next visit, how to use this Denneroll, how to get that arc of life restored so that you can get the brain power firing down through that spinal cord, out those nerves to your neck and back into those vital organs again. It's going to give you relief and it's going to help your future as well. Thank you.